I'd like to thank everyone who came. I know it's hard to get people together, and especially 11 o'clock during the work day. But I really do appreciate each and every one of you taking the time to come. This is just, it's a joy to be here in Orange. I can't say that enough. Where's my... What? I think I need glasses about the size of those scissors. But, you know, when the announcement came out from Carol's office that we were officially here and members, I think within 30 seconds I got a note from this guy to say welcome, and you know, so it's just, I've got so many nice notes from everybody, and I look forward to working with all of you. With that, I'd like to introduce why we're here, Dr. Young and his wife Deanna.
But he can...
So Deanna's our CFO. She's the brains behind the operation, I say. But thanks for having us here. It's a real pleasure. You know, our goal and our mission at Stony Creek Urgent Care is to really bring the ER to you without the ER costs. So some of the things that we provide is what you would 85% of what you would find in the ER: IV medicines, IV fluids, sutures, broken bones, pretty much anything that you would usually think about going to the ER for, we'll take care of here for the cost of an office visit. And I think in this new healthcare era, as we move forward, that's going to be more and more sought after and required to contain costs. Because this current status quo in the healthcare model really doesn't work. I think, you know, and I'm reminded with the tragedy in Boston that, you know, something that you may have seen it, we posted on our Facebook, a quote by Mr. Rogers, who, you know, remembered what his mother had always told him. So, remember the helpers. Look for the helpers. And that's kind of a role I think we'd like to fill too. Let's be the helpers, you know, in the community. Community outreach, I think, is very important. We've been very involved in supporting our community businesses any way we could. So really, that's our mission: is to be part of the community as a safety net. A safety net for the community, a safety net for the docs, for the primary care doctors who have nowhere else to send their patients if they can't see you. Where can you go? The old habits are send everybody to the ER. The ER will take care of everything for enormous cost. But that's no longer tenable. And so a lot of the primary care physicians and specialists are looking to us to help be their safety net. And be comfortable with knowing that their patients can receive the highest level of care, and go back to their family physician and thank you, you know, and keep you out of the hospital ultimately. You know, as everybody knows, that, you know, with the current model, you know, we have a very good sick care system, not a health care system, and what ends up happening is because there's no safety net, and there's no quality places to go to get quality care, you end up falling through the cracks and end up needing the ER and needing to be admitted where otherwise it could have been avoided on weekends and evenings. That's a huge deal, and in this day and age, that's going to be more and more of a requirement of the public, of insurance companies. So thank you for having us.
Coffee, cake?
Coffee, cake.